Hi, my name is John Saltzman, and I'm a gastroenterologist at Brigham and Women's Hospital in Boston, and I serve as the chair of the editorial board for GIE for the ASGE. It's my pleasure to tell you about our top 10 topics for the year 2024, and this is an article that's currently in press in GIE that you can read. And what we do on the GIE editorial board is to perform an annual review of all the endoscopic literature from the prior year. So in this case, 2024. And what we do is we look at the general internal medicine journals of big impact, such as the New England Journal of Medicine, the Annals of Internal Medicine, Lancet, JAMA, the major GI journals, Gastro, American Journal of Gastro, Clinical Gastro and Hepatology, Gut, as well as endoscopy, as well as the complement of the GIE family of journals. And then each member of the editorial board is evaluating topics and articles on three main criteria. What is their significance? What is their novelty? And what is their impact on clinical practice? And we all develop candidate lists of what are the top 10 topics, and we then vote as a committee and come down to 10 topics. So that's what we did this past year. We tried to balance advanced endoscopy topics and general topics. And we think that this list is going to be of interest to all endoscopists who performed endoscopy as part of their clinical practice, everyone who's interested in this field of endoscopy or who does research in this field, as we try to highlight new techniques, emerging areas of focus, and changing our clinical practice. So the top 10 topics that we picked for the year 2024 were GLP-1 receptor agonists and endoscopy, advances in AI, ergonomics in endoscopy, per oral endoscopic myotomy, POEM, bariatric and metabolic endoscopy, endoscopic resection methods in the colon, gastric intestinal metaplasia in endoscopy, inflammatory bowel disease in endoscopy, GI bleeding risk stratification in endoscopic therapies, and number 10, therapeutic endoscopic ultrasound. So what I thought I would do for a couple of minutes, review some of these topics and some of the papers that we highlighted. This is just to give you a flavor of what's in this article and hopefully to stimulate your appetite to learn more and read more. And this is a very digestible way to catch up with what's new in the year. And we think it's going to be of interest to all endoscopists. So first, the GLP-1 receptor agonists. We all know these drugs, and their use are really controversial in the endoscopy world because their effects on GI motility, as well as their potential safety impacts during procedural assessment, sedation, as well as the quality of the exams. This past year, there's been much new information that's come out about these drugs in endoscopy. And one study that looked at the performance of EGD and colonoscopy together in patients on these drugs versus not on these drugs, and they showed that, versus just having EGD alone, they showed there was significantly reduced gastric contents in the patients who were having both the colonoscopy and the upper endoscopy. And this is likely due to a liquid diet, and there was no worsening of the bowel preps on these. So a multi-society GI statement came out, and it did not support stopping the GLP-1s before endoscopic procedures. So that seemed like a good recommendation for us. However, there have been other guidelines that have had different recommendations, including from the ASA. The ASA recommend holding the GLP-1 drug for elective procedure, and the duration of holding it dependent on the GLP-1 drug and how often it's administered and dose, etc. A liquid diet was recommended for 24 hours prior to procedure, and anesthesia consultation in patients who had symptoms suggestive of gastroparesis despite holding the medications, or for patients who had emergent or time-sensitive endoscopies who had not held the GLP-1 drugs. All right. How about advances in artificial intelligence or AI? We all know about this now applied to colonoscopy and improving our ADRs and reducing our adenoma miss rates. But AI is expanding way past colon in endoscopy, moving into esophagus with Barrett's, stomach with gastric intestinal metaplasia, GI bleeding, endoscopic ultrasound, and IBD. And we go over these topics. And we all know that this is coming into our clinical practice. It's not already there, and hopefully it's going to improve our quality of what we do and improve patient outcomes. Another topic that's near and dear to my heart is ergonomics and endoscopy. And this area is increasingly recognized as important. And the AST had recently issued guidelines about ergonomics. We know that the career prevalence of endoscopy-related injuries is high, with carpal tunnel 5%, tenosynovitis, and almost 10%, often requiring surgical interventions. Now, this topic is near and dear to me as an advanced endoscopist who's been high volume for many years, who's required having both hands injected multiple times and eventually having surgery on both my hands so I can continue to practice. There are sex differences in ergonomics where it is harder on female endoscopists generally because of their smaller hand size, and our scopes are not designed for their use and for small hands. Women have reported a significantly higher risk of injuries than men, more like in the 60% versus 40%. So we need more education, how to prevent this from these injuries from happening, what we can do to prevent them, and endoscopes need to change. Unfortunately, at DDW this year, I did see some new endoscope designs that were lighter, a little bit tighter in the control areas for smaller hands, as well as had the larger dials that could be placed on top of the small dials to help people. Another field that has been changing rapidly is bariatric and metabolic endoscopy. This area is now an established option for weight loss. Field's maturing. Endoscopic sleeve gastroscopy ESG is an effective option, seen to be safe. All classes of obesity and a low rate of adverse events, and a reported weight loss at about 12% at 5 years. There's now data coming out about combinations of ESG with weight loss medications, and the combination seems to be even better. And finally, there was an article on robotic suturing device, which actually seems to be making suturing more accessible to the general endoscopy practitioner, perform in a more standardized way, and hopefully we'll see more of this. There have been several reports, important reports about endoscopic resection in the colon. This has included trials on cold smear, hot smear, EMR, different techniques. The ESGE had guidelines that basically for colon polypectomy and EMR recommend cold smear polypectomy or EMR for all sessile serrated lesions. So this may be a new practice for you. Also, there's been new data coming out about soft coag and how it's important to reduce polyp recurrence, particularly on these larger polyps or anyone we're not sure of, by applying it, as this is an important methodology. In terms of gastrointestinal metaplasia, we know it's important to survey patients who have intestinal metaplasia to try to prevent or detect early cancers. And some of the data this past year was looking at applying the proper biopsy protocols, the Sydney protocols. And if we can do this, we hopefully will be able to survey it properly as well as apply surveillance techniques such as MBI. There have been new guidelines in IBD published this past year, specifically for endoscopy, reviewing endoscopic timing, how to biopsy, how to deal with strictures. And there's been new data in terms of strictures about using stricturotomy as opposed to balloon dilation, which in the right hand seems to be very helpful. GI bleeding, there's a lot of new information about predictive scores and low risk and high risk. There's been information about metoclopramide and trials, whether this works or doesn't work. There's new information about over the scope clips and primary control. Finally, there's an excellent review by Andy Tao that came out this year in January about the topical hemostatic agents. And the last topic we covered was the therapeutic endoscopic ultrasound, and the ASGE published a review this past, a guideline on this, which reviewed all the available data. So this has been a quick, rapid overview of the top 10 endoscopy topics that we discuss in detail. I hope this stimulates to read the article in greater detail. It'll be a quick, enjoyable review of our top endoscopy topics this past year. So thank you for watching.